Despite all of the hazards that firefighters face, the greatest threat to their well-being comes from the body's own response to the stress of performing the job. Year after year, about 50% of all firefighter line-of-duty deaths are due to sudden cardiac events such as heart attacks, a percentage that is stubbornly high and relatively steady over many years. Heat stress and dehydration are common challenges on the fire ground. Perhaps they are so familiar that we underestimate the profound impact they have on firefighters. A study conducted by Dr. Smith and her research team at Skidmore College investigated the twin challenges of heat stress and dehydration on measures of cardiac and vascular function. Participants performed alternating periods of work and rest on a treadmill under conditions in which we manipulated heat stress and dehydration. Heat stress was created by having participants walk in full structural PPE. In contrast, in the no heat stress, trial subjects walked while wearing a cooling vest and a weighted vest that simulated the weight of turnouts. We induced 3% dehydration by mildly restricting fluid intake before the study and limiting water during the tests. The results clearly show that heat stress has a profound effect on heart rate during work. When subjects walked in the weighted vest, heart rate rose to just over 100 beats per minute for each exercise period. But look at the difference in heart rate when they did the same exercise in turnouts. Now heart rate is over 150 beats per minute. And when the subjects were dehydrated and in turnouts, heart rate rose to nearly 160 beats per minute. In addition to higher heart rates, heat stress caused by walking in turnouts also caused core temperature to be higher. Core temperature was even greater when the subject was dehydrated and exercised in turnouts. Ultrasound measures obtained before and after the test revealed that heat stress increases the amount of work the heart performs and increases vascular stiffness. So what is the bottom line for firefighters? Even though heat stress is a familiar experience on the fire ground, it can lead to profound cardiovascular stress that may increase the risk for sudden cardiac events. And dehydration magnifies the cardiovascular effects of heat stress. Even moderate heat stress caused by walking in turnouts in a laboratory caused dramatically higher heart rates and led to significant cardiac and vascular changes. Responses on the fire ground would likely be even more dramatic. Although heat stress is a familiar enemy on the fire ground, it should be aggressively combated. To do so, firefighters should utilize effective incident rehabilitation strategies, including doffing gear as soon as possible to improve cooling, use aggressive cooling techniques such as forearm immersion, ingesting cold fluids, using wet towels to promote cooling on hot days. Stay hydrated before the emergency to minimize rise in core temperature. Participate in a physical fitness program to increase thermal tolerance, decrease cardiovascular strain, and provide cardio protection. This study was made possible by funding from the Assistance to Firefighters Grant program. Learn more about the study by visiting our website at www.skidmore.edu/responder.